So I read through your intake paperwork, and it seems like you're having pain in the right side of your neck and up into your head a little bit. Is that correct?
Yeah.
Okay. And it's been happening on and off for about 6 months. Is that correct?
Yeah, I would say always past 6 months.
Okay. And I saw in your intake form that you're coming in through direct access. Have you seen your primary care regarding these headaches or anything yet?
Not for this, no. I have a primary care doctor that I see regularly,
Okay.
but I haven't talked to him. I have like a friend from college who's a physical therapist, and she told me to try physical
Just
therapy.
come here?
Yeah.
Okay. Okay. And then what kick-started your pain? Like, when did you notice it start?
I am a dentist,
Okay.
and I do oral surgery. So when I'm like in a long procedure, or just have like a stressful day, a lot of back-to-back surgeries with no break, that's when I'll get like pretty bad on the right side. Yeah.
Is it more of like a headache problem or like your neck problem, would you say, or both?
I feel like both. Like
Both.
it's definitely in my neck too, but it kind of like comes around almost. Sometimes all the way up to like my eyebrow.
Okay, it's like all the way up the side.
Yeah.
Okay. Sorry, I'm just taking notes as we go, so I'm listening, but I'm also taking notes.
It's okay, I did it.
Okay, and I saw that you circled that the pain is worse during the day, I'm assuming with work and like doing long procedures and things at work.
Yeah.
It's also at night. Do you have any trouble sleeping or anything? Does it keep you up at night sometimes, or not really?
Sometimes I do feel like when I can like finally rest, or maybe have someone like rub it out a little bit, that might help. But
Okay.
yeah, after like a long day at night, I do feel like that's when I get home and I realize like how bad my head is hurting.
You stop. It's
Yeah.
like, oh, okay. Are there certain activities that aggravate the pain? Is it like your posture, like when you're like you look down a lot, or
Yeah,
you're
so I'm
kinda-
almost kind of in this position and
Okay.
like working with my hands in front, so I do feel like my head,
you're kind of
yeah,
pushed
kind of
forward.
that posture that I
Yeah.
was just in.
Yeah. Okay. And then you wrote on here it's about a 6 out of 10 at its worst, and then a 1 out of 10 at its best. Is that correct?
Yeah, I work Monday through Friday, so I would say by like Saturday afternoon, Sunday, it's probably down to like a 1.
Okay. It's like after rest, like after you're not
Yeah.
working. Okay.
I'm not working those days, but then by like the middle of the week, the end of the week, especially when I come home from work, that's when it's like a 6 or sometimes a 7.
Okay. What would you say it's at right now?
Probably like a 4.
A 4. Okay. Is it that still like same type of pain, like achy? Does it? You said it shoots up your head. Is it kind of like shooting up into that right side of your head? Is that?
Yeah, it's kind of like just dull, like around the whole like right
neck
side.
here, and then it
Yeah.
shoots up. Okay. Does it ever go down like your back or into your arm at all, like in your shoulder?
No.
Just like in your head?
Yeah.
Okay. Are you ever dizzy or anything? Sometimes?
No.
No? Okay. Has your vision changed at all in the past 6 months since this started?
No.
Do you have difficulty, like when you're in conversation, like trying to focus, or like trying to articulate your words or anything? You can
No.
focus pretty well
Yeah.
still? Okay. Have you had any problems eating or like swallowing, like chewing? Does your jaw ever hurt or anything? No, it's mostly like up higher.
Yeah.
Okay.
As a dentist, I make sure I keep my jaw. in
Yes,
good
there
shape.
you go. Have you fainted or lost consciousness recently at all?
No.
Okay. Any nausea or vomiting?
No.
did you have surgery or anything on it?
No.
Okay. Does it ever bother you at all now?
No.
Okay. And then I see on your medication list that you're taking pain medication and allergy medication, kind of like as needed. Are you taking that every day now, or?
Yeah, I take Claritin D every day,
Okay.
just one tablet, and then if I have like, I know it's gonna be a really busy day, back-to-back procedures, I will take like 600 milligrams of Tylenol.
Okay.
So that's probably like at least 2 days a week I'll do that.
Okay.
I really try and get by without it,
Mm-hmm.
but I do take about 600 milligrams, probably 2 to maybe 3 times a week.
Okay. And then I saw in there that you have a vegan diet. Are you taking any supplements along with that, or is it just strictly no animal products? Or?
Yeah, I take B12,
Okay.
like a B12 complex.
Do you take like a daily multivitamin? and stuff
Yeah.
too? Okay. And then I saw that you wrote on there that you tried to go get acupuncture done, but it didn't really. You wrote on there it didn't really do anything. Is that true?
Yeah.
Just like
I tried
didn't do
it.
anything.
No, I tried
Okay.
it. I think it was like a month ago.
Yeah.
Just
Just to
willing to
see.
try anything.
Yeah. I mean, yeah. If it's painful, you gotta do what you can. And you said you work full time.
Yeah.
Do you do any thing recreationally? Do you play any sports or anything outside of work, or?
I just lift weights like strength training, basic. It's not like HIIT or CrossFit or anything. It's just basic gym, like 3 days a week with my husband.
Okay.
That seems to be fine though. It's really just like I try and get that done in the morning,
Okay.
and then it's like after my long work day that.
It's probably that like one posture you're in
Yeah.
that's really driving it, which sucks because you can't really
I know.
change that, you know?
Yeah.
Do you have any trouble driving, like when you turn to like check your blind spots or anything? Do you ever notice?
No, because I'm turning to my left, and that's
More.
not terrible, but definitely like if I have to look to my right
Mhm.
in traffic, that is a little bit
Slightly.
worse. Yeah.
Torso. Okay. Okay. And I see you have one child.
Mm-hmm.
How old is your child?
She's 6.
Oh, cute.
Yes. We're in the
That's
kindergarten.
a fun time. And I also see that you've never been to the hospital or had any surgery or anything, but you do have an x-ray. Is it an x-ray of your head and neck? Did you,
Yeah, they wanted to look at my
the right side?
cervical. Yeah.
Okay. Do you have that record with you, or can you bring it maybe next time?
Yeah, I can talk to my doctor. and
Get through it.
yeah.
Okay. Sounds good. All right. And then looking through your vitals upon coming in, everything looks good. Is there anything else I should know before we get started?
No.
Okay. I do want to say before we start, you might be a little sore after today because I'm going to kind of be poking on you a little bit. So I apologize in advance. But hopefully we can assess how you're moving, what you're feeling, and come up with a plan of care that works for both of us.
Okay.
Help you out a little bit. Okay.
Okay.
All right, and I will probably have to touch some parts of your neck, maybe part of your shoulder, the side of your head, maybe up a little bit in your face. Is that okay?
Yeah.
Okay.
Just let me know if I ever need to move my hair.
Okay. All right, so I'm gonna have you stay seated.
Okay.
I'm gonna have you sit up nice and tall, plant your feet on the floor, and I'm just gonna have you look up towards the ceiling all the way, and then down towards the floor. Any pain with that?
No, more of just like a stretch.
Like a stretch? Does
Yeah.
it feel stiff or anything?
When I come down,
Down
a little bit.
okay.
Yeah.
Okay. And now I'm gonna have you put your ear towards your shoulder. So do your left side first, so left ear towards your shoulder.
Just a stretch.
Good. Okay.
Kind of.
I'm just gonna push on some parts of your neck and you just let me know if anything is painful or kind of feels different, then you just like put pressure on me like that, okay?
Okay. Yeah, that's a little tender.
Yeah. When I move lower, does it get better, worse, or about the same?
It's about the same through there.
Okay. How about down here?
That gets better.
It's better as I get lower?
Yeah.
Okay. So when I palpate more up top up here, it's a little more tender?
Yeah.
Okay. So better lower?
Yeah.
Okay. Alright, I'm gonna have you flip onto your back for me. Alright, what I'm gonna have you do is you're gonna kind of tuck your chin into your chest and you're gonna lift your head up. And what I'm gonna do is I'm gonna apply some pressure to your forehead. You're just gonna resist that pressure and try and hold it as much as you can, okay?
Okay.
Alright, so go ahead, tuck your chin, lift up. Good. Push down, hold. It's okay.
That's hard.
That's okay. Okay, so the next one I'm gonna do is I'm gonna grab your head and I'm gonna kind of do that same motion where I'm gonna tuck your chin all the way into your chest.
Okay.
And I'm gonna kind of rotate side to side.
Okay.
But I'm gonna do all the work, so just rest your head in my hands.
Okay.
Yep. And if it's painful, just let me know and I'll stop, okay?
I think that might be part of my problem is I don't know how to relax.
Relax. It's hard for some people. Okay, so I'm gonna lift you up. Give me your head. Alright, I'm gonna rotate to the left. That's okay?
Mm-hmm.
Okay. Rotate to the right. Right there?
Yeah.
Okay, that's okay. Good. Relax. Okay. So the last one I'm gonna have you do, so I'm gonna have you do that same motion where you're gonna tuck your chin in, and then you're gonna lift your head, just your head up off the table, and I'm gonna time you how long you can hold that for,
Okay.
and then as soon as it's super painful, you can't say anymore, just relax and let your head go.
Okay.
Let me get my timer ready. Alright, whenever you're ready, go ahead and tuck that chin, lift up, good. Hold, hold it.
This is hard.
It is hard. You're doing good. Right there?
Yeah.
Okay. Alright. Just gonna write down some of those things. Alright, you can go ahead and sit back up for me if you want. Go ahead and sit back in that chair. You got 14.5 seconds. So, what's considered normal for that test is about 38 seconds,
Wow.
which is really long. So when we get your muscles stronger and kind of work on some things, I'm sure your time will improve. We'll definitely recheck that again as we have more visits and everything.
Okay.
So after doing everything today, and based on what you're telling me about the pain in your neck, up into your head, have you ever heard of a cervicogenic headache before?
I think like back in school, I think
And your friends
sounds
physical
familiar.
therapist?
Yeah.
Okay. Most people haven't, I mean, I didn't hear about it until I was in PT school, so, but it's usually that unilateral, you have that kind of neck pain, and that kind of causes that one-sided headache.
Mm-hmm.
So that could be due to many things. I think the main thing for you is your posture, because you're kind of in that, like, your head's down like this a lot, your shoulders are back, so kind of fixing that posture, working on those neck muscles should kind of help with that radiating headache in your right side. I will give you some exercises to kind of do, probably more of those chin tucks, kind of get those deeper muscles stronger. And then today I'll probably do some soft tissue